Hi everyone, and welcome back to ClinPsy Explained. My name is Ian and I am a clinical psychologist working in the UK. This video is all about Cognitive Behavioural Therapy, or CBT. If I'm being completely honest, if you're an aspiring clinical psychologist and you're looking at this video to try and understand the concepts a little bit better, don't. Watch something else. They'll be much more detailed and there's plenty of books out there that are better. This is more aimed at clients who might be accessing a CBT session for the first time and want to know what to expect or want to know how can this help me. So this is for you. If you're a regular to watching these videos, you know that I just flash up the disclaimer for a while. You're probably sick of reading it, but it's only up there for a few seconds. CBT is so popular at the minute. There's lots and lots of manuals about how to perform it, and there's lots of self-help materials out there that people can access to maybe use it in their private lives without maybe like a psychologist or a therapist being involved. One of the reasons it is so popular is because it's got a good evidence base behind it, and that sort of means that research has showed that it works, and that's really, really important now within the NHS and within other healthcare systems. We don't want clients to just go in and hope that something's going to get better. CBT has shown that if we apply it, then things can get better. So it tends to be used as the first line of treatment. This means if someone was going in and had low mood and was put into a GP, then rather than maybe getting medication or another type of therapy, they might sort of be given CBT therapy, and that might be 6 to 8 sessions. So it's really, really popular at the minute. It's hard. If you've watched one of my other videos on formulations, this diagram here might be quite familiar to you. This is a CBT hot cross bun model and helps explain how thoughts, feelings, change in your body and behaviours all interact with one another. And this is the basis for starting off a CBT intervention, understanding what the problem is and what thoughts or behaviours someone is doing and how they feel about that. The world is so complex and so confusing that as humans, our brains have sort of adapted and try and take shortcuts as much as possible. And sometimes these shortcuts are fantastic. They really, really help us out a lot, that we can just filter out a lot of information that we don't need and concentrate on things. At other times though, we can get caught into patterns or loops, and this is where negative automatic thoughts come in. And some that you might be familiar with are maybe trying to predict the future, or mind reading, or catastrophizing, thinking that the worst thing will happen, or maybe making a mountain out of a molehill, as in, it's quite a small problem, but then it suddenly gets much bigger. And these things come in, and these things tend to maintain problems. So a good example is you've got a party kind of coming up, and a negative thought might be, no one will miss me if I'm not there. So that's mind reading, that's trying to predict the future. And that might lead us to avoid the party and not go. But because we haven't been there, we haven't seen what people's reactions are, when the next party comes up, we might avoid that one as well because we get caught in that trap. And we also tend to behave in ways that confirms it. So the party example was a good one. You avoid the party, you behave in a way that confirms what you think, that no one will miss you. Another kind of one might be if you're scared of spiders and you think that every time you see one, the spider's gonna run towards you, jump on you, bite you, poison you. And if every time you see a spider you run away, you haven't given yourself the opportunity to find out that that doesn't happen, that they're probably more scared of you than you are of them, and we just haven't learned any different behaviour. I can hear you all sort of saying, well, that's all well and good, Ian, but how does that actually help me with my problems? How does it lead to any significant change? So let's look at this example. This is one that I love to give to people to help show what CBT does and how it can work. So this is a situation. I want you to imagine that you are asleep upstairs in bed and you hear a crash or a bang downstairs. And maybe we're asking you to think negatively to start off with. So a negative thought might be, it's a burglar. So that might lead to all sorts of feelings, but the most common ones tend to be anxiety, worries, stress, panic. Some people even get angry as well. How dare they break into my house? It could lead on to a panic reaction. So you might sort of feel quite breathless, quite hot, and maybe you become quite hypervigilant. And that means that you become sensitive to any sort of noise or anything that confirms what you're thinking, that it is a burglar. And you might sort of decide to, pull the covers up a little bit more, or stay quiet, or just listen out for a noise. But you're not disconfirming the thought that it's a burglar. You're sitting there looking for all the evidence that confirms it is a burglar, rather than maybe exploring it, or going downstairs, or trying to rationalise what it actually could be. And CBT highlights these problems and then asks you to look at alternatives. So let's look at an alternative. This is now a more positive thought. So the situation is exactly the same. Still asleep upstairs, still hear a crash downstairs. But a thought this time could be, it's the cat. It's knocked over something downstairs, or it's come in from a night of hunting. So maybe we don't have as many feelings as we did the last time. Might be a bit annoyed that it's woken you up, but generally kind of okay. There's no sort of like panic reactions because, well, it's just the cat. And the reaction might be to kind of go back to bed and go to sleep. And you can see with this loop that it doesn't sort of keep on going round in a circle. It's broken with that behaviour, because going back to sleep just confirms the more positive thought that it's nothing to worry about, it's just the cat. So this is how CBT can be useful. So we've tried to change the thought and it's led to a completely different outcome, even though the situation is exactly the same. Compared to other therapeutic approaches, CBT is quite short-term in nature. So first-line treatment, you might only have 6 to 8 sessions. That's 6 to 8 hours of work where you might go to see a therapist. And right from the start, it's very goal-directed. So we're not going to waste your time by kind of coming in and asking all these questions, being really nosy. No, we're there to do some work. We're there to make some changes and to help you. So right from the start, we set a goal. So if you're panicking in situations, right, that's our goal, right? How are we going to fix this thing? And each session, we might monitor progress to see how things are going, to make sure, that homework's being done between sessions, although we try not to always call it homework, and to see if we need maybe more sessions, less, whatever it is. That's a really basic overview of what CBT is. I suppose the theory behind it and the formulations that we sort of put in place to help people understand. How change happens is it's a collaborative effort. As a therapist, we sort of help guide someone to make the changes for themselves, maybe to recognise the patterns they get themselves into, to recognise whenever negative thoughts maybe happen, to challenge themselves either between sessions to try something different. I don't know, going into a public place if that fills them with dread. But we might also do things what we call in vivo exposure, and so that's maybe exposure in the therapy room. So I don't know, if someone was scared of being in public situations, we might actually go to a supermarket together, or maybe actually ask this person to do a presentation in front of other mental health colleagues to help give them that exposure, to show them that they can do something and the worst thing doesn't happen. It's not as bad as they thought it was going to be. And we monitor things. So, what's your mind telling you? That people will laugh, that they'll make fun of you. Right, well, how was it? Did they do that? No. Okay, so what have we learned then? Can we take this information into other situations, and can you apply it, when you're out and about? We also might use things like relaxation techniques to help reduce any anxiety, and loads and loads of other things that it's just beyond the scope of this video to kind of go on into. But if you're accessing appointments for the first time, your therapist will sort of talk you through it. Or like I said earlier in the video, there's loads and loads of materials out there on the internet or in bookstores to find out more about CBT and to apply it to everyday life. So that was a really, really quick overview of what CBT is. I don't really consider myself a CBT expert, so I hope some of it was useful, but there are experts out there if you want to kind of go and get that information. A quick Google search will bring up absolutely tons of stuff to do your own research in your own time. But I hope this was a good overview. If you've got any comments about this video, please leave them on the YouTube comment section. You can follow me on Twitter at @whatisclinpsy, and you can send me an email and the details will be at the end. So I'm going to go off and think about doing the next video, so I'll see you soon.